Okay, so I think we'll get started. So thank you everybody for joining our webinar today, which is Living Well with Glaucoma, Tips and Innovative Solutions, Innovative Technology Solutions. And this World Glaucoma Week, Quantum's delighted to be partnering with Glaucoma Australia to bring you this webinar. We have Sapna Nand, who's an Orthoptist Educator with Glaucoma Australia, who'll be presenting today and talking about glaucoma and how Glaucoma Australia supports people. And we also have Gillian and Sarah who are here as well. And we have Rob Drummond, Business Manager and Senior Low Vision Consultant from Quantum, who will be talking about how aids and different equipment might be able to help you if you have got low vision. So my name's Rebecca Clark, and I'll just do a quick introduction. So first of all, I'd like to acknowledge the traditional owners of the lands from which this webinar is being presented and pay my respects to any elders past or present. And for me, it's the Darug people of the Eora Nation. And if you're in Australia and you know where you're the lands that, which you're on, then feel free to put that in the chat. So just a bit of webinar housekeeping. If you've not joined any of our webinars before, your microphone will be muted, but we will have a question and answer session at the end. And if you do have any questions, do put them either in the Q&A area, which you can click on, or tab to. There's also, you can put them in the chat, which the keystroke for that is alternate if you're a Windows user, or Command K if you're a Mac user. If you've got any technical difficulties, you can also put that in the chat and I'll monitor that. And we are recording the webinar, so that will be made available via YouTube link afterwards. So just a bit of an overview of today's session. First of all, we'll have a presentation by Sapna Nand, who's an Orthoptist Educator with Glaucoma Australia, and she's also a qualified orthoptist, has had clinical practice for many years. And then we'll have a presentation by Rob Drummond, explaining how Quantum can help with low vision aids and different things and how that can help you. And then we'll have time for question and answers. So I will now hand over to Sapna, and she can begin her presentation and tell us all about glaucoma and Glaucoma Australia. So thank you, Sapna.
Thanks, Rebecca. So we'll just get our presentation started. So good morning, everyone. It's World Glaucoma Week, and it's great to be able to join in this morning to raise awareness of the condition. So today I will go over some facts about glaucoma. We'll have a look at the risk factors, types of treatments available, and lifestyle tips on living with glaucoma. Okay, so we'll start off with a short video to better understand the impact glaucoma can have over time. So what is glaucoma? Glaucoma is the name given to a group of eye diseases where the vision is lost due to damage to the optic nerve. As you can see from the previous video, the loss of sight is gradual and a fairly large amount of side vision may be lost before there is an awareness of any problem at all. Unfortunately, there is no cure and vision loss cannot be reversed. Our aim is to detect and start treatment to prevent any further vision loss from there on. And looking at numbers, 2 in 100 Australians will develop glaucoma in their lifetime. You are 10 times more likely to develop glaucoma if a direct relative has it, and 50% of people with glaucoma don't know that they have it. It is estimated that over 300,000 people in Australia have glaucoma, but only half of them are actually diagnosed. Out of those diagnosed, only half adhere to their treatment and appointments, which increases their risk of losing vision. Out of those undiagnosed, half are totally unaware that they are at risk of glaucoma. Okay, so we'll have a look at another video next. Here we have real glaucoma patients sharing their experience on how they felt when they were first diagnosed.
How do you feel when you were first diagnosed with glaucoma?
And how do you feel now?
I can't really remember how I felt. I was disappointed.
The idea of it makes me nervous.
Well, when I was first diagnosed with glaucoma, I really didn't have a clue.
It was a very big shock to the system.
I was scared, confused, because I didn't know what it was.
I felt pretty upset.
I didn't know if it was anything that I had done to cause glaucoma.
You know, of course, there's a time where you feel sorry for yourself and you have to go all through that emotions.
But now I know better.
There's great things out there, great technology and medication now to help you.
I think the idea of getting onto it early has given me a confidence that there are options.
I've been very blessed with good health and I can cope with the glaucoma.
So good news is that with early detection and with the correct treatment and management plan, you can save your sight from glaucoma. Okay, we'll have a look at what actually causes it. So the eye is constantly producing a clear fluid called the aqueous humor. This fluid just sort of rotates within the eye. This fluid nourishes the eye and holds the eye in shape. The fluid is then drained out in an area called the anterior chamber angle or the drainage angle. If there is damage to the drainage angle, the rate at which the eye produces the aqueous humor then becomes greater than the rate that the eye can drain it. And this is where high pressure builds up. So if you think of a sink with a blocked drain, the water will keep rising unless the drainage system is cleared and starts working again. So this increase in pressure begins to damage the optic nerve, which lies at the back of the eye. The optic nerve is made up of approximately 1 million nerve fiber layers, which connect the back of the eye to the brain. Damage to the cells to the optic nerve results in irreversible damage to your eyesight. Okay, so glaucoma is usually caused by an increase in intraocular pressure, or we say IOP or eye pressure, which can damage the optic nerve. Normal eye pressure is between 10 to 21, but having eye pressure within this range does not mean that you can't get glaucoma. The level of elevated eye pressure, which causes progressive damage to the optic nerve, does vary between people as well. So people who have glaucoma should not compare their eye pressure to somebody else. They can end up stressing out and thinking why the other person has a lower eye pressure to themselves. Each person is different, and the level of eye pressure they can tolerate is different as well. Some people can have high eye pressure and actually not have glaucoma, and we know this is ocular hypertension, while other people can have normal eye pressure and have glaucoma, and that is normal tension glaucoma. All forms of glaucoma treatment will aim to reduce the eye pressure to a level that is safe for that person. So each glaucoma patient will have a different target eye pressure. Okay, we'll look at the risk factors of glaucoma. Okay, anyone may develop glaucoma, but the incidence does increase with age. 1 in 10,000 babies are actually born with it. And by the age 40, 1 in 200 have glaucoma. This rises to 1 in 8 by the age 80. Other risk factors are being of African or Asian descent, having diabetes, being very long or short-sighted, if you've been on long-term use of steroid treatments, if you experience migraine, have a history of eye injury or operations, if you have a history of high or low blood pressure, and if you experience obstructive sleep apnea. Family history is one of the main risk factors of glaucoma. If there is a family history of glaucoma, then regular eye checks should start 5 to 10 years earlier than the age of onset of the affected relative. And then also you've got thin corneas. So thin corneas can give the impression of having a lower eye pressure than what it actually is. And then we mentioned it increases with age, and then there's high eye pressure as well. But it's important to remember that we do have low and normal tension glaucoma as well. To check if you are at risk of developing glaucoma, you can head to the Glaucoma Australia website to do a quick and simple quiz. The quiz results can let you know if you are at risk of glaucoma and also advise you on how often you should be getting checked for it. Now, there are two main different types of glaucoma. You've got open angle, and that's 90% of cases in Australia. This is where the drain of the eye is wide open, and the damage is usually caused by high eye pressure. Then you've got closed angle glaucoma, which is around 10% of cases. This is where the drain of the eye is narrow, and that's just how people are born with it. Now, glaucoma cannot be self-detected. Only an optometrist or an ophthalmologist can determine whether you have glaucoma or not. Glaucoma Australia recommends all Australians aged 50 or over to visit an optometrist every 2 years for a full eye examination. If there is a family history of glaucoma, or if they have Asian or African descent, it is recommended to get eyes checked every 2 years from the age of 40. There are a few different tests that need to be done to diagnose glaucoma. And so we'll just go over those ones here. So we've got obviously eye pressure. Then we've got something called a gonioscopy, which is to inspect the drainage angle of the eye. Then we have to have a look at the optic nerve at the back to determine the damage that, if there is any damage done to it. And that's done on a slit lamp, which is like a large microscope. Visual field test to test the central and peripheral vision. Something called an OCT scan, which is actually a computerized picture of the optic nerve, and then the thickness of the cornea that we spoke about before. Now, although there is no cure for glaucoma, most people are able to manage their condition successfully with the use of eye drops, laser treatments, surgery, or a combination of all three. The purpose of glaucoma treatment is to lower the eye pressure within the eye in order to prevent deterioration of the optic nerve, which causes vision loss. It is important to note that while treatment can prevent vision loss, it cannot restore sight that's already lost to it, which is why early detection is so important. Okay, so let's see what our patients have to say about how hard it is to treat and manage your glaucoma.
How hard is it to treat and manage glaucoma?
Not hard at all.
Well, I don't think the treatment is very difficult.
I think that's a very individual case-by-case situation.
I don't believe it's hard.
So it's not that difficult.
Pretty easy, actually.
It's been relatively easy to manage and treat.
Each case is individual. You get tests pretty much every year or every 6 months.
I have field tests every 6 months.
I get the eye pressure checks pretty regularly.
Once every 3 months I go to the ophthalmologist.
Check in with your doctor regularly.
Mum has special drops which help keep her pressures down.
It takes less than a minute.
As long as you stick the medication you're given.
Drops in the morning, drops in the evening.
Which decrease your eye pressure.
It's just something you do every day. You clean your teeth every day. You wash your face every day.
Treating it and managing it.
I think it's very easy to manage.
You put your drops in every day. Not a problem.
So glaucoma eye drops is the most common form of treatment for glaucoma. Eye drops work in two ways to reduce eye pressure. So they reduce the amount of fluid actually made by the eye, and then they also help increase the outflow of aqueous fluid from the drainage angle. Approximately 1/2 of patients do not take their glaucoma medication as prescribed, increasing the amount of visual loss caused by glaucoma. Since glaucoma often has no symptoms, people may be tempted to stop taking or may forget to take their medication or eye drops. If you have any concerns about eye drops, speak to healthcare professionals or call Glaucoma Australia on 1800 500 880. Then we've got laser treatments. So different lasers are used to treat open and closed angle glaucoma. There's SLT, and it's generally used for open angle glaucoma to reduce eye pressure. Then we've got something called an iridotomy. It's for narrow or closed angle to reduce the risk of an acute angle closure. So an acute angle closure attack is a sudden rise in eye pressure, which is a medical emergency. Okay, and then we have glaucoma surgery. So surgery may sometimes be required if the disease cannot be controlled using medications or laser, or the patient is intolerant of the laser and the eye drops. The requirement for surgery becomes more urgent and the more aggressive or advanced the glaucoma becomes. The 3 main types of surgeries we've got going is trabeculectomy. Then there's a whole group of surgeries called MIGS, and that's minimally invasive glaucoma surgery. And then we've got the glaucoma drainage devices. Okay, so we'll have a look at another video from some of our patients about a question that has worried many at risk and diagnosed with glaucoma, which is, do you worry about going blind?
Do you worry about going blind? Not really.
Yes, of course.
Yes, of course. I mean, if I wouldn't worry, then I wouldn't care.
Yes and no.
I don't think about it.
I think it's always in the back of your head.
Well, I think it's the probably biggest fear of any human being.
No, it doesn't occur to me.
Very much so.
Yes, very much so.
I'm going blind, it's a fact.
I've done a few little tests myself by finding my way around the home with my eyes closed. I couldn't picture being blind. It'd be so frightening to me.
Going blind obviously completely changes your life.
I know that I've already lost some peripheral vision in my left eye.
I do my very best to keep my vision.
The key is early awareness, catching it early, treating it early.
I do everything I possibly can to look after my eyes.
Regular checkups. Listen to your doctor.
I've had all the tests. I get them every year.
I don't miss my drops. I don't miss my appointments. I don't miss my field tests.
Just manage it as much as you can.
And be mindful of any change whatsoever.
You must look after your eyes.
Okay, so glaucoma is a lifelong condition. We need to ensure patients are comfortable with everyone in their support network and they are confident about the decisions made regarding their eye health. It is important to have trust in the expertise of your eye care professionals so that you understand and adhere to treatment and management plans to save the health of your eyes and maintain your quality of life. All right, so let's have a look at the healthcare team involved in patient care for glaucoma. We have ophthalmologist, an optometrist, we have a pharmacist, a GP or general practitioner, and then we've got the orthoptist. The ophthalmologist is known as the eye doctor, the surgeon, and the eye specialist. And they are trained and registered to provide total care of eyes, from performing comprehensive eye examinations to prescribing lenses. They diagnose a disease and also carry out medical and surgical procedures. So your ophthalmologists are the only providers of laser and surgical correction of eye disorders such as glaucoma. Okay, so the optometrist is usually the first person to flag that a person has glaucoma. So most people who get referred over to Glaucoma Australia, they had their glaucoma picked up at a regular eye examination with the optometrist. Most people link the optometrist to glasses, but optometrists have a unique role in providing accessible and vital eye care to the community. They can monitor the glaucoma, they can prescribe eye drops if needed, but they usually work together with the ophthalmologist in a shared care plan for a glaucoma patient. All right, and then we've got the orthoptist. So while not many people know what an orthoptist is, many have been helped by one. Your orthoptist is usually the first eye care professional you will see when you go for your appointments with your eye specialist. So they're the people who will do all the testing before you see the eye specialist. Traditionally, orthoptists work with eye movement disorders, but they also work in low vision clinics and rehabilitations and research centers as well. And then we've got our pharmacist. And so the pharmacists, they're the experts on medications and drugs. Pharmacists can now also help with glaucoma screening because some of them do have the equipment to check eye pressure at the pharmacy as well. And they can also help patients increase their adherence to treatment by discussing about their glaucoma drops and the side effects of it. A glaucoma patient can see the pharmacist for purchasing the eye drops if they need help with instilling the eye drops. So to go over the correct techniques and to learn how to use aids for eye drop installation. If they have questions about other medications, interacting with glaucoma eye drops. If they have questions about how glaucoma eye drops can affect their other health conditions. If they need help with choosing things like lubricating eye drops for dry eyes, assistance with lid hygiene and blepharitis. So your pharmacist can help out with quite a few things. And then we've got the GP, which is the family doctor. They're usually the first person to go to if you have a health issue. And they have a broad knowledge and skills to treat all health issues throughout the patient's life. The GP can provide a referral to see a specialist, and they can coordinate the shared care plan between several different health professionals. Glaucoma patients can go to their GP for a renewed script of their glaucoma drops. However, it's important to remember that your GP does not have the equipment that the optometrist or the ophthalmologist has to determine whether the treatment is working for you. So at some point, you do need to go back to your eye specialist just to ensure that the drops that you are getting from the GP is still the correct ones for you. So Glaucoma Australia is also here to support you. If you haven't done so, please consider joining up to start receiving free education and support on glaucoma. Our purpose is to improve the lives of people with glaucoma and those at risk by increasing early detection and positive treatment outcomes through education, advocacy, and research. We empower individuals to take an active interest in and understand their own eye health. And we promote research, innovation, and work with eye care health professionals. All right, so here is a list of common topics of discussions that we come across over our free helpline and online support groups. Vitamin B3, yoga and glaucoma, weightlifting and swimming, impact of caffeine on eye pressure, deciding about laser or surgery if eye drops have stopped working for you, if you have side effects of eye drops, recovery after surgery, so what to expect before and after, and then COVID vaccinations and glaucoma. All right, so we'll just go through a couple of diet tips that can be beneficial for glaucoma. Because optic nerve health depends on healthy blood vessels as well, food that helps to maintain blood vessel health is likely to promote visual health. So a diet that is reduced in saturated fats. If you can increase the intake of vegetables and fruits, which are rich in vitamin A and C, green leafy vegetables, carrots, berries, citrus fruits, and peaches. Oh, I guess fruits such as peaches, not just peaches. Caffeine is also thought to increase the production of fluid within the eye. So if you can limit your intake of coffee to 2 to 3 cups a day, so a maximum of 340 milligrams of caffeine is still considered high for a person with glaucoma. We often get asked questions about vitamins and supplements that are beneficial to eye health. So apart from fish oil supplements, vitamin B3 has also shown to help. There is still ongoing research, but it has shown to protect the optic nerve cells and possibly preventing glaucoma. So please speak to your pharmacist about your suitability for taking vitamin B3 and follow the instructions on the packaging. Okay, so yoga is a hot topic on our helpline. Every person with glaucoma wants to do yoga these days. Our advice is for those with glaucoma who like to practice yoga is to avoid the downward dog position, and that can increase eye pressure. We do have a glaucoma safe video on the website if you'd like to have a look at it. For those who like swimming, swimming goggles have shown to increase eye pressure when they're on. So the larger snorkeling goggles type, which sort of sit on the bones for around the eye, are safer, as the smaller ones can sort of press on the eye and increase eye pressure as well. And there is also evidence to suggest that regular to moderate exercise, such as brisk walking or jogging, can reduce eye pressure, which could be beneficial for people with glaucoma. Okay, so as mentioned before, it's easy to join in to our services and start receiving the free support and education to help you with your journey with glaucoma. So you can go on our website and join in, or you can also just call up 1-800-500-880, and then we can help you with the process from there on. Okay, so each person that enters our patient support journey receives individually tailored phone calls and emails. We support people through all stages of glaucoma, from new suspects to long-term diagnosis. We can help you prepare for your upcoming appointments, discuss the outcome of recent appointments, and we also provide ongoing support for those who have high anxiety. So here's a few ways to get in touch with us. We've got our free support line. Our website is full with resources and articles. We have a 24-hour web chat on the website as well. We've got SMS, you can email us, and then we also have some support groups set up online. So you have to go through our Facebook for that. We've got the Glaucoma Australia Facebook support group, and then we've got a congenital glaucoma one for families with kids with glaucoma, and then we also have an Instagram page as well. All right, so a little bit more about our support groups. So our Glaucoma Australia support group currently has more than 1,200 members. Our congenital group, although it's around 260 members, it's still the largest in the world. So that type of glaucoma is rare. So that's a really nice supportive group we've got there. Our support groups are available 24 hours. It's private and secure, and it is regulated by qualified health professionals. So patients supported by Glaucoma Australia have shown to have 92% adherence rate to their appointments and eye drops. They're compliant with their treatment. They have shown to have reduced anxiety, and they have also shown to have increased understanding of glaucoma, and they also feel empowered to be in control of their glaucoma. All right, thank you for listening in. Please feel free to contact Glaucoma Australia if you have any questions regarding the information provided in this presentation.
Oh, thank you, Sapna. That was great. There's a lot of information there, and we've got some questions coming already, but we'll answer those in our question and answer session. So now we're going to hand over to Rob Drummond, who's going to talk about different aids and how Quantum might be able to help for those who might have low vision due to glaucoma or whatever, and other eye conditions as well, but yeah, with specific reference to glaucoma today. So Rob's our senior low vision consultant and business manager, and has been seeing lots of people to help them with vision aids for a long time. So how long is it now, Rob? And has a background in optical.
Yeah,
I'll leave it to you.
All right. Okay. Thanks, Beck, and thanks, Sapna, for that insight into glaucoma. A lot of the information that we just heard there is often, I guess, either not known or often not understood by people. One of the most important things with anything to do with your eyes is just to make sure, if you've been given some sort of treatment plan, please just make sure you do follow that. So I'm going to present some of the products from our fairly vast range of low vision aids that would specifically help people with glaucoma. Now, glaucoma is not the only eye disease out there, of course. A lot of people would have heard of macular degeneration, perhaps diabetic retinopathy, retinitis pigmentosa, all sorts of other eye conditions. And All the eye conditions, no matter what they are, lead to this sort of general term we use, which is called low vision. And low vision is, to put it into some sort of perspective, is basically when glasses don't help anymore. Glasses may still be of assistance, but they're not going to provide you necessarily the amount of vision, clarity of vision that you're required to do certain tasks. So that's where we can step in with some of these products and help you out. So just in terms of these products, I'm going to mention them because it's going to be fairly general. What we are going to be doing, though, perhaps on a one-on-one with individuals, is actually dig into exactly what's happening for that person. And that's really the take-home part of today. Part of it is, yes, there is a range of products that could certainly help. But because there is such a range, it's very important that we sit down and have a chat with people and figure out exactly what works, not only to overcome that problem, but perhaps that problem in a different environment. So just because we need to be able to read something, maybe reading something at home is going to be different to reading something, say, when we're out and about and shopping. So what we're doing, as I say, is fairly general, but please contact us at some stage and have a deeper conversation. Alrighty, so the first thing we can do is look at how we can change what's naturally there. So if I pick up a magazine, for example, I can simply put on my glasses and magically I can read it. Now we've got pretty good lighting here in our showroom, but if I wanted to see this, I'm really struggling to see just regular print in a magazine. Must have my glasses. The other alternative is that I can go outside in the sunlight and I can read newsprint and magazine print quite comfortably. And the reason for that is it's nothing particularly magical about sunlight other than it's really bright. So being really bright means that there's good contrast between the print and the background that it's printed on. And I can emulate that to some degree inside by getting the right sort of lighting. And again, there's a variety of these, but if I turn this light on here, and if I position it correctly, I can now actually read this reasonably well, just because we've got that nice bright light there. Importance of light, though, is that the light in this situation is quite close to the page. And if we take that light further away from the page, the brightness level on the page actually decreases and we can't quite see it so well. So many of these lights have got the ability to be adjusted for height and position, and also you don't want that light shining into your eyes when you're reading, so you can turn that away. So the light's there and it's nice and comfortable. So good lighting, very important in the early stages. The next part is perhaps we're starting to see that finer print is getting harder and harder to see. So maybe we need a magnifier, and many people might have seen something similar. This is optional with the light. You can buy the light and get the magnifier later, but now I can just hold that magazine on the other side of the magnifying lens, and that's coming up now, magnified roughly, not quite 2 times, but depends really where you hold it. But the good thing now is I've got 2 things working for me. One's the light, the other thing is the magnifier. So that's great, that's plugged into the main, so you can't really take that shopping with you. You might like to have one in your walker, for example, in your handbag, in your back pocket or something like that. So there are portable magnifiers, and for example, there's a magnifier such as this one here. This one's quite a weak one. We know it's weak just because it's large, just like the magnifier and that light I showed you a moment ago. If we go to a stronger magnifier, typically they're smaller. Not always, but normally that's the case. both of these have lights available, and that light again gives that contrast, and a bit of magnification helps you out when you're reading. So that's obviously a lot more portable and might suit you better for some situations. Some people
are you able to angle that at the camera, Rob, so we can see the print coming up?
Oh, I can do that. Sweetly.
There you go.
A bit of an idea what it might be like.
That's better. Yeah. There you
go. Okay. So as you can see there, when I'm if I get the magnifier too close, there's not a lot of magnification. But if I pull it up to the right level, then we start getting it magnified maybe 1.5 to 2 times, something like that. These sorts of magnifiers, there's not a lot of difference actually, but what we've got now is something that's on a stand. So if you've got problems holding the other magnifier in just the right position, the stand now holds the magnifier in just the right position, and we still have the light source available there. And oops, might be a bit hard to see on this one. There you go. Oops. But you can get to see there that you've got almost the column width of that magazine article in your field of view. And this magnifier, again, fairly large. It is weak. It's about a 2 times magnifier. So those are the sorts of things that you can get in the early stages. Should also show you that there's some things people like doing craft and going to little craft groups and things like that. This is a portable, rechargeable magnifier with light. So you can just set that up on a table, and maybe you can do whatever it is you need to do it underneath. And it's also got the lights there, which are surrounding the lens. So again, I'll just use the magazine as an example, but you can just place things underneath that. That's probably too bright, but you get the idea. Same sort of thing. And that just gives you the ability with your hands, with craft work, to work underneath it. So quite a handy thing. They go for 2 or 3 hours or something like that, just on a single charge. Okay, so those are things that you may be familiar with, good lights and magnifying glasses. The other sorts of things we can do is to use electronic magnifiers, and they're available in quite a variety of different formats and forms, and it's all to do with the sorts of things you want to do and pretty much in the way you want to do them. These days we have a very large variety. So for something, if you wanted to, if you're out shopping and you wanted to check, the details on, whatever this is and pass the source, I can just put the magnifier, this electronic magnifier, directly on top, and that's the very small print there of the ingredients that's on the side of this jar. So something like this one's nice and small, relatively thin, and that just gives you the ability to, a gents pop it in top pocket perhaps, or in the handbag or whatever. But that's a nice, easy way of seeing something. Now, the electronic ones have got a couple of advantages. If you recall, when we had the magnifying glass, you can change the vision of what the image of what you're looking at with movement of the magnifying glass. Sometimes that can be distracting and a little bit hard to deal with. With the electronic magnifier, as long as you've got an image on the screen, in some ways it doesn't matter where you hold it. It's just sitting, in this case, flat on the page, and that image size is now stable. So it's a lot easier to readily recognize something. The other thing we can do with an electronic magnifier is change the print size. and that's important. Now, if you think of a book or a menu that might have a certain print size and probably larger than you might find in a magazine or a newspaper. So, and particularly if we're starting to look at products like we just showed a few moments ago. So having the ability to vary the amount of magnification means that you've just got the ability to see better or more information on the screen. The other thing electronic magnifiers can do is you can also change the contrast. So contrast is very important with these devices, and particularly with glaucoma. A lot of people in the very early stages with glaucoma might benefit from a magnifier, but they'll benefit first of all from good lighting, and secondly from high contrast or a different color contrast. So this magnifier at the moment is just looking down at this regular black and white print, but now it's turning it into black on yellow, or as I was showing before, other colors. So that's blue print on a white background, yellow on blue, and blue on yellow, green on black, black on green, etc. So there's quite a range that's available, and some of these other color schemes are actually more comfortable and indeed easier to see for people. So having the ability to not only vary magnification, but also to change contrasts is very important. And these electronic magnifiers, as I say, are available in a variety of different sizes to suit different environments. So the first two I showed you was a 3.5-inch screen, the little one here. This last one was a 6-inch screen. There's a 7, this one's a 10. And you can imagine with the bigger screen, you get a lot more information on the screen. And this one behind me is one with a 24-inch screen. And that might be useful because you want to see a whole variety, much bigger field of view, or you might like to read a book. And then we've got some different contrasts, and with glaucoma, sometimes you're lucky enough to be able to read with the lowest magnification, which means you get a nice big field of view, and there's the full width of the page across the screen. So you can sit back, albeit at a desk, but you can sit back and read fairly naturally. That one off. So everything I've shown you so far is to do things visually. But quite often, and it could be for a whole variety of reasons, but quite often people do like the idea of being able to listen to things. And lots of people have heard of talking books. Well, we've got devices that can actually read things to you from the paper. So for example, this little device here, so it's about the size of a couple of biros, I guess, and there's some buttons down one side, but at the pointy end, as it were, there's a camera. So if I point this camera at the page and press a button, it takes a picture of the page.
The active meet the hardworking patrolmen across our NSW and ACT country service centres when you're driving.
And now it starts reading to me. So the ability to have pretty much any printed material read to you means that no matter what situation you're in terms of the degree of vision loss, or for that matter, the amount of light that's available to you to be able to see, or whatever degree of magnification you might have, in some ways doesn't matter, because all you know is that you've got this device. You can just quite quickly take a picture, and listen to it.
And thank you. As you may know, I am retiring
So
from the NRMA.
turning text-to-speech is a wonderful thing these days, and when you can pop it in your pocket or wear it around your neck on a lanyard, just means that you can have it anywhere. And this sort of technology is becoming now a lot more, well, very accessible, very lightweight, portable, but it's turning up in other devices as well. So this larger device I showed you a few moments ago, the 24-inch screen, you can get that together with a speech component as well. So it can do two things for you, much in the same way as some of these smaller devices can do it also. So that's just very briefly what is available to help people specifically to help them with glaucoma and reading and doing visual tasks. So once again, good lighting in the right position, perhaps some magnification with magnifying glasses or even the electronic ones. And then lastly, the ability to have text read to you. Those are the different ways that we can help you, and just a matter of being in touch with us so we can discuss what might best suit you in your environment.
Well, thank you, Rob.
Thank you. Thank you.
Yeah, that was a great overview. So yeah, I'll just briefly share my screen again. So yeah, now we've got time for questions. So we have got some that people had submitted earlier and some that are in the chat. And I think Sapna's already answered some of those or provided information. But yes, I'll just get hold of the questions that were submitted, and we'll go through those and hopefully provide some answers. So stop sharing again. Okay, so now there are a couple for the Glaucoma Australia and Sapna probably here. So somebody had asked, is there a device to make administering the eye drops easier for people with limited hand function?
Yes, we do. So we have eye drop aids. Some are quite brand specific, but they all sort of depend on what size their bottle is and what brand of eye drops they have. So all they need to do is just, it is available on our website as well. But if you just call that helpline number, so 1-800-500-880, just let the person on the other side know exactly which drops you have and the size of the bottle, and then they can arrange for it to be sent out to you.
Thank you. And I think, yes, you have already really answered this one, but somebody had asked what type of support groups there are available. So is it just the Facebook ones?
We have the Facebook ones because obviously anyone from anywhere in the country, in the world can sort of join in, and it's active daily. Pre-COVID, we did have face-to-face support groups. So we were doing sort of educational sessions in the major cities and towns. Obviously, that's all been on hold. It's been hard to get it going, but we are hoping that once things settle down a bit, we can get back to that. But, you know, through the support group, we have had people sort of meet up for coffee and things like that as well. So just keep an eye out for any events coming up on our website. We still do have educational sessions, especially out in Perth. But just if you just keep an eye out on our website and our Facebook page, you will know which ones are coming up.
Okay, thank you. So probably the next one that might not have been covered already here, probably for Rob. So what can I do to make the writing on the computer screen brighter for me? And is there a technician that can come and set up my computer?
Alrighty, so this could be a very long answer, but I guess the short version is most computers, and this is whether they're Windows or Apple computers, have got quite reasonable accessibility functions built into them. So with Windows, there's narrator, and there's things like Magnifier and VoiceOver within the Apple platforms. A lot of people get by with those quite successfully. However, where they fall down is a little bit with in the same way that, say, there's a difference with between the magnifying glass and the electronic magnifier. And that main difference is that the electronic magnifier has been purpose-built to do a job, and one of those things is to provide that higher contrast. To do that properly, there's a program that you can put on your, just Windows computer called Zoom Text. And Zoom Text will do for anything on your computer what a magnifier would do. And it will magnify everything, not just content of email or perhaps web pages, but it will also magnify your menus, taskbars, and things like that that normally don't get magnified using the Windows or some of the Windows features. The other advantage of Zoom Text, some of the other advantages, is that you can select larger coloured pointers and cursor enhancements. There's even, you can program your keyboard so that you press a certain button and that highlights exactly where the cursor or the mouse may be. You can also change the colours. So rather than your normal coloured screen, you can actually turn your computer into a yellow on black or a black on white or whatever the case may be. Again, quite similar to what we're able to do with the little electronic handheld magnifiers. So the options are there. Just got to, again, figure out what works for you in your situation. Can someone come out and help you? We can certainly talk you through how to do these things. Working with a lady at the moment who's about a 6-hour drive from us here in Sydney, and we're doing all of that remotely on the phone. She's doing things on her computer, she's describing them to me, and we're able to get a good result. So we don't always have to have a technician or somebody come out to visit. Oftentimes we can get a pretty good result just with remote support. We can do Zoom sessions as well for people, which we do quite frequently.
Thanks, Rob. And there's probably a couple that are a bit similar here, or might have a similar answer. One's my house is very dull and I keep having falls. Who can help me make my home safer?
Yep.
And the other one was about being nervous about doing groceries, and who can stop me? What can help me stop me bumping into people?
Yeah. Yeah. Okay. So, look, around home, a lot of people have made the change to LED downlights in their home, and they're sort of similar lighting to what I showed you earlier with this reading lamp. But of course, the light is up in the ceiling, and that's good for sort of general walking around. In terms of being able to see things better at home, and as you're walking around the home, you probably need to get a good electrician in and get some good advice. And there's quite a few good lighting shops around that will provide that advice, and might even be able to point you in the right direction of somebody who can make those upgrades for you. The kitchen and the bathroom are often two areas that people mention to me where they've made changes to their lighting in those areas, and it's made a huge difference. You can take that to the rest of the house as well if required. The other thing you can do is there's another group of people that can help you, and they're called O&Ms, Orientation and Mobility Specialists. Now, these people know how to get people around safely in the various environments that you might be operating in. So that could be around home, it could be between home and the bus stop or the train stop, or wherever you need to go. And then when you get to your destination, they can help you get around, perhaps that shopping area, the public library, walk down to the bank, etc. So O&M specialists are not something that we get involved with. We refer people to a couple of organisations you probably know the names of, So one is Vision Australia, the other one is Guide Dogs. So that's, I guess, New South Wales specific, but both Guide Dogs have various organisations, perhaps by different names in other states, but so in WA and also Tasmania, that would be Visibility. In South Australia, there's the Royal Society for the Blind, but there is also Guide Dogs SA and NT. And the Guide Dogs organisations are known by, Victoria, New South Wales, ACT or Queensland in the eastern states. But everywhere there is a Guide Dogs organisation, and Vision Australia are based on the eastern seaboard and in WA as well, in Perth.
Thanks for that, Rob. There's another one. Oh, who can I call to help me with vision aids? I guess that we'd be at least one people. So yeah. Call us.
Yeah, I guess, yeah, look, call us. A lot of people, I guess, in the early stages go through this process of, trying different things. And sometimes you've got, helpful family members or neighbours and whatnot that might have, had something themselves sitting around and they've handed it over and it's okay. And that's, good and well. But if you want to start digging down into ways to do things really well, then it's good to see a range of what's available. And generally what we do when we come out to see people is we will try people with a variety of things. We just don't stop at the simple magnifying glass because you can now read the food packet or something like that. We will take that further. We will show you a variety of the electronic things, and we certainly will show you something that talks to you. And we do that for a couple of reasons. One, that may trigger a bit of a memory of, oh yes, I forgot I needed to do that. The other thing is that even though something might be suitable for you today, it's good to know that if your vision does drop off in the future, that there is something that is going to help you throughout any stage of that vision loss, wherever that may end. So it's good to see and have that background knowledge before you make your decisions. And that number that's above Beck's left shoulder there, the 1300 883853 phone number, is our line into all of our offices, and the guys there on that phone number will be able to put you through to the person in your area who can take care of you. Yeah.
Okay. And yeah, I suppose similar answer. Suppose I need someone to come to my house to help me with low vision. My GP doesn't know who to refer me to, but yeah, depending on what exactly you need. Might be one of the organisations. It could be, we can come and show you the equipment at home most of the time.
Yeah, we spend most of our time. Look, a lot of GPs probably won't know. They may just say, "I'll go to, whoever the peak body is, and the local town or city." We can come to you, and that's how we spend most of our time. So when I'm not giving webinars and getting stuff organised around Quantum, I'm out in the field in people's homes, and that's good for a couple of reasons. But the main thing is, I guess, that when you're at home, you've got a variety of things that are yours, and there could be tasks, there could be something specific you need to see. People have got their little Bibles there with ultra small print. I'm struggling to read that even with my glasses, but with any of these devices, perhaps we've got a good result. So things like that you've got around home, we can really make our visit more pertinent to you. As I said before, if you are remote, we can do the telehealth thing and help you out in that way.
Okay, so and Sapna and Sarah and people have been doing a great job answering things on the chat, but I might just read it out for the people who haven't seen that. So there was talk about managing coffee intake for caffeine limits, and does that include tea as well? And I think Sapna had said that tea might be a bit better because it's got antioxidants. Is that right, Sapna?
Yeah, so tea has less caffeine than coffee.
Okay.
So for those who have reached the limit of 2 to 3 cups of coffee a day, if you'd still like a hot drink, tea has antioxidants as well. But, there is also decaffeinated coffee if you are after the taste. Yeah.
Yeah. Good point. And there's lots of links in the chat with living with glaucoma and other things. Rob's touched on this. Do we allow trialing of equipment? Yeah, we can come out and show you equipment depending on where you are in terms of, so people can try before they buy in most instances. That's an option. The name of the reading pen, that's the Orcam Read. So, and I think we had a question about the price of that. That one's $2,499. We've got a range of different things. Did you want to talk to that, Rob? So, because there's different. Talk to text. Yeah, talk to text aid.
Yeah, look, I guess in terms of price range, in general, the lights we've got are from daylight. We don't have any of the, I guess, cheaper sorts of lamps that might look the same, but they just don't give the same sort of result. And that's mainly because the lighting in these things is really very, very good, high quality lighting, good even spread, and just the right lighting temperature for someone who requires the contrast that people with glaucoma particularly are going to need. So they're pretty much all of these are rated at 6,000 degrees Kelvin, and that's the temperature of light. And you might notice if you've been shopping for lights that you can get a warm light, or a cool light, or a white light. So all of those are different degrees Kelvin. But anyway, the upshot is that the lighting, depending on the device, for example, this one here on a floor stand, and I think even with the magnifying attachment is just a tad over 300 thereabouts. Other lights might only be 100, 150. Magnifying glasses, again, we don't compete with the $20 ones from Bunnings and places like that, but these are all optically designed and whatnot, again with the right colour temperature of the lighting. And these ones will range in price from about $140 up to about $300. Electronic magnifiers, so this is sort of how long's a piece of string. So the little ones, as you might think, would be relatively inexpensive, and they are, so they're about $300. And they gradually go up in price depending on their other capabilities, size, etc. And you get something like the 24-inch one behind me, for example, which is about $5,500. Talking devices, as Beck said, this one's the pen one here, Orcam Read's about $2,500. And there are other versions of Orcam. People may have seen one that sort of clips on the side of a pair of glasses. They're about $6,000 to $7,000. But there's also a talking device that just sits. That's all it does. But it sits and looks a little bit like an old transistor radio. Sits on a desk, and they're about in the high threes to about $4,000. So that very broadly is the price range across the board.
Yeah, and I guess we can mention if people have got, say, got NDIS funding or anything like that, or if it's something for workplace, there's various funding options out there for people with low vision. So that's right. With that, so. That's right.
So there's the NDIS. There's also people with a gold card with Veterans Affairs. And if you're at work and you're needing these things, then there's a scheme which is you can Google under the name of Job Access, and that works really well. There could be some funding available through a Commonwealth Home Care package. There's various funding arrangements that we're supplying this whole variety of equipment into, just depending on the criteria and conditions of those funders.
Mm-hmm. Yeah, great. Okay, and I don't think there's any other questions. What I will do, the various links that the guys at Glaucoma Australia has provided, or I can provide put those in the email that will be sent around with the video recording, so people have got access to that. I will just share our contact details. And yeah, you wanted to say anything in summary, Rob? Or?
No, but thank you to, other than to thank Sapna and the team at Glaucoma Australia for being part of today. You've probably had a really busy week, so I think you might be able to relax now.
Yeah, so yeah, many thanks for that. So yeah, if people are wanting information, there's things on our website, quantumrlv.com.au or 1300 883 853 or info@quantumrlv.com.au, and we have got people all around the country, so can help. And yes, a really big thanks to Sapna and the team. So it's been great to have you on board and learn so much about glaucoma. So
thank you. Thanks for having us.
I'll leave it there.